Now, my patients who perished, had they gone to the hospital, they would have been placed either, well, two possibilities. They either would have ended up in the intensive care unit on a ventilator, or depending upon the crisis level in the hospital, they might have been not offered ICU level care because of rationing. Now, it turns out that at Griffin Hospital, they did not reach that level. I think Danbury Hospital came very close to running out of ventilators. In fact, they opened up 2 additional intensive care unit regions for extra ventilator capacity. So my patients knew that there was a chance, even if they did go to the hospital, that they wouldn't be offered a ventilator, but the majority of them knew, and it was my recommendation, my opinion, that should their breathing function deteriorate to the level of requiring a ventilator, that the chances of their survival was slim to none. And that research, or that opinion, was confirmed by the report of Northwell Hospital System's experience that 80% of their ICU patients with COVID have perished. This is a disease that, especially as a function of age, is deadly. It's lethal. It is a lethal disease. Now, so 30%, so I experienced in my facility 30% mortality. That's what a a lethal pandemic does.
Dan, what are your thoughts on the slow reopening of businesses around Connecticut?
It's something that could have been, well, my opinion and I have relied at least on understanding how leadership can respond to these events. I've been listening a lot to Governor Cuomo, and I think that he's probably provide the greatest leadership, certainly the greatest leadership style. The idea that is the question is, how do you move forward, recognizing that this crisis has such damaging effects beyond the health? So I think the first criteria was the concerns about, will you overload a healthcare system and then suffer excess mortality, deaths, because you don't even have the ability to care for people? That's number one. It's all about reducing the number, trying to protect the greatest number of people, trying to limit how many people suffer mortality, death, or morbidity, the consequences of illness from this illness. Hold on just a second, Penny, sorry. Okay, sorry about that. So it is a necessary process to figure out how to keep an economy going, because we have basic needs. We have needs for food and shelter. So the problem is that the politics have become a factor where we're focusing on too much on the politics and not focusing on the science and the economics. And if we could focus on the science and the economics and forget about the politics, we could maybe come up with rational strategies about how to do this. But what's happening is a slow reopening. I think New York and Connecticut and Massachusetts and New Jersey are doing it the best that they can. Um, I think the rest of the country will regret their decisions because they have allowed the politics. They have not controlled properly the message of unification for people. So what you have now is you just have a divided population. Those who, you know, recognize this for the crisis that it is, and those who say, well, you know what, the American way of life. Chris Christie said the threat to the American way of life isn't the American way of life. Give me your tired, your poor, your huddled masses. A way of life of protection. And we are failing. We are failing once again.
What what do you see and what would you hope to see as we move forward?
Uh, I would hope to see um, that people will make good decisions. Decisions that are based not on I think or I have a hunch, but a decision based on the best available information. And I think that it's, um, I, 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 I was yesterday when the president decided not to close down the task force. I think people could use that as an opportunity to be very critical. Um, I'm going to save my criticisms for later because that's not what we need to do. What I said to myself was, good decision, and I'm going to leave it at that. And I'm not going to second guess. I don't really care why he came to that decision, but good decision. So I think we need good decisions. Um, what Governor Cuomo's message of wear the mask, not because you don't want to get sick, it's so that you don't make somebody else sick. And if we all do that to the best extent possible, if we say to ourselves, what can I do um, to do my part in getting through this and keeping others safe? So I think good decisions, and I'm hoping that when, which I expect, and I think really all the other scientists expect there to be spikes. And we're going to see it differently in rural America because rural America is not as densely populated. It's the density of population which is the catalyst for rapid spread of a viral infection. It's people living close to one another. That's why you're seeing it in nursing facilities, prisons, um, in impoverished portions of the country where people live close to one another. Where you see it in places where people don't live close to one another, it's going to be sporadic. But you will see it in, you know, outbreaks. So it'll be it's not the 300,000 people of New York City, but you're going to see the 300 workers in a poultry processing plant or or a pork processing plant or a factory where, again, people are close to one another. So when those outbreaks occur, um, I'm hoping that the leaders recognize that and then maybe take a step back. The other thing is it's I'm hoping that it's not so overstated as to become annoying, but testing. Without testing, you have basically no hope of managing this crisis. And it's not just one-time testing. It's going to be repeated testing, identification of individuals who are probably asymptomatic but contagious, and isolating them. So we move from what we've done right now, which is a mitigation strategy, and mitigation strategies are the most costly and most damaging to the economics of a society. But we need to move to what's described as a containment strategy. So you identify small pockets and then you contain. But going forward, we'll, you know, everything's different now. You're not gonna, you're gonna think twice about what you touch and where you go.
Well, hopefully, science knowledge will be listened to more carefully, certainly by our leaders and certainly by public health department, so that eventually we can figure out what to do with these illnesses. Do you anticipate more of similar types of outbreaks as we move forward? Not
Yeah,
just COVID-19, but of
yeah.
other
Well,
viruses.
uh, it's hard to say. We're always at risk. So I don't think COVID-19 itself has made us more susceptible. I don't know. You know, public health specialists might have a better explanation for that. In some ways, it may make us more aware and more able to respond. So, for example, we will have an influenza season because we have that every year. So, what we expect beginning in the fall is to layer on top of what will probably be the existing COVID infections. We'll have influenza A, B, or H1N1 seasonal flu, and that just becomes an added burden on the system and an added complication. However, we'll all be in protective equipment because, one of the questions you asked, how will my work change? Well, my work is going to change. I don't foresee in the near future, certainly for the next year, 2 years, that I will ever be showing my face to my patients. I will be wearing a mask. So I
Right.
had to. So I saw a patient yesterday, and she actually wasn't my patient, but another patient in the facility. But she was looking at me, so I waved to her. I said, "Hi, how are you? Are you doing okay?" And I didn't get the. I was smiling beneath my mask, but what do we expect when we smile? We expect the other person to smile back.
Right.
And I said to her, I said, "You can't see this, but I'm smiling at you." And then she smiled.
Oh. Dan, if you could give a word of hope to both the UJC community and just the general community, what would that hope be for you?
um, a hope that we all maintain compassion, that we all maintain trust in what we hear from the people who study this, um, that they're doing the best that they can in terms of the guidance. But remain compassionate, remain hopeful, reimagine. Again, I'm going back to the words of Governor Cuomo. This is an opportunity. I'm doing it for myself. My work will, like I said, my work will never be the same. I don't think it'll ever be the same. My work is going to shift now to probably 50% telemedicine. My teaching is, at least for the foreseeable future, will all be distance learning. It's all done by Zoom, which is incredibly challenging. I find it exhausting to do Zoom sessions, much more so than in-person teaching and communication. But focus on the compassion, focus on the support, the trust of leadership, and try to reimagine. We all need to just come up with something better than what we have now.
Amen.